Dr. Rajiv Kumar. I will be presenting on management of craniofacial cleft. Craniofacial cleft, a rare form of congenital malformation, is an abnormal disfigurement of the face and cranium occurring along the predictable embryonic lines. It may be hypoplastic, hyperplastic, normal but clefted. Easier on the basis of anatomy and operative intervention, classified them from 0 to 14 that follow well-defined zones of the face and orbit and correlate well with embryologic developmental maps. Our aim and objective was to study the distribution of craniofacial clefts with respect to age at presentation, sex, and type of cleft. Surgical outcomes of the craniofacial cleft operated during the study period and complications associated with the surgical procedure. It was a hospital-based retrospective analytical study from January 2017 to April 2025. The sample size was 16. There were 7 cases of cleft 0, 1 cases of cleft 2, 3, 5 each, 3 cases of cleft 4 and 7 each. There were 10 male patients. There were 10 female patients and 6 male patients. Out of the 7 cases of cleft 0, 3 were male, 4 were female. Cleft 2, 3 and 5 had 1 female patient each. Cleft 4 had 1 male patient and 2 female patients. Cleft 7 had 2 male patients and 1 female patient. 3 cases of cleft 0 presented below the 5 years of age. 1 case presented in the age group 6 to 10 years. 2 cases presented in the age group 11 to 15 years. And 1 case presented in the age group 16 to 20 years. Rest other clefts, the patient presented below 5 years of age. Out of 7 cases of cleft 0, 2 were hypoplastic, 4 were hyperplastic, and 1 was dysgraphia. In post-op period, 4 patients developed edema, 1 patient where columella creation was done developed respiratory complication, and 1 patient required secondary rhinoplasty in follow-up period. This patient with cleft 0, hyperplasia, excision of excess tissue was done, osteotomy was done, and rhinoplasty using Elster graft was done. After she attained skeletal maturity, she underwent revision rhinoplasty. This patient with cleft 0 dysgraphia underwent excision of the excess tissue and osteotomy, and this was his follow-up picture. Next patient had a defect of middle third of the ala, which was repaired by paramedian forehead flap, and it has satisfactory aesthetic outcome. In next patient of cleft 3, alar base was displaced and there was broad dorsum of the nose. It was repaired by nasolabial flap, but however, a satisfactory aesthetic outcome could not be achieved. Out of 3 cases of cleft 4, 1 case was bilateral with right-sided anophthalmos and left-sided microophthalmos. The duration of surgery was more than 120 minutes in this patient. The next one was bilateral without any other anomaly. The duration of surgery was in between 60 to 120 minutes. And the third one, right-sided unilateral, the duration of surgery was less than 60 minutes. This patient of cleft 4 underwent multiple surgery. For facial cleft repair, paramedian forehead flap was given, and for cleft palate, buttock 2 flap palatoplasty was done, and cleft lip repair was done by using Fisher's technique. However, in the follow-up period, this patient developed ectropion, which was corrected by scar excision and FTSG. The next patient with bilateral cleft 5 and bilateral anophthalmos, multiple genoplasty was done, and the duration of surgery was around 2 hours. Out of 3 cases of cleft 7, 1 was bilateral cleft 7 without any other anomaly. The second one was right-sided cleft 7 with microtia and preauricular skin tag, and the third one was left-sided cleft 7 with preauricular skin tag. The duration of surgery for unilateral cases were less than 60 minutes, and for bilateral cases it was 60 to 120 minutes. This patient with cleft 7 underwent macrostomia correction by muscle opposition and commissuroplasty. To conclude, we found most patients presented with cleft 0 in our OPD, mostly females within 5 years of the age. 1 patient with cleft 0 with hyperplasia type underwent corrective rhinoplasty after she attained skeletal maturity, and 1 patient with cleft 0 hypoplasia type where lip closure and columella creation was done. She developed respiratory complication in the post-op period and unfortunately she expired on the post-op day 7. Thank you.